My name is Doug Mueller, and I'm the service tech here. I'm going to kind of talk to you about the machine itself. Right now I have the bellows filled up. I've got the controller on. This is our small animal side. This is our large animal side over here. This is going to be our patient circuit for this demonstration. We have a little bit of weight on there to kind of mimic a horse's or a camel's lung rib cage, to make sure that there's some weight there to push the bellows back down. This is our absorber section. The absorber material goes in here. This is for filtering out the carbon monoxide from the animal's lung after it breathes in. This is our breathing circuit. This would normally be where the endotracheal tube is connected up to the patient. And here is a monitoring station right here. These tubes are about 61 inches long, and they go directly into the absorber circuit. This is expiratory side. This is inspiratory side. This elbow over here goes down to the bottom of the bellows of the animal circuit. This box, our control box, is for is going to control the pushing down on the top of the bellows. This is what's going to drive the bellows down. These are just valves inside the box here, which allow the mainstream air to come in and go down and push the bellows, but it also has a scavenger section in the middle where the scavenger port will be vented out through a vacuum system. This is our flow control. This determines how much flow goes over our vaporizers, which will be mounted right here in this section. You can mount 2 vaporizers. The newer models have a little bit different. They have like slots, so they can be moved a little bit left or right, but that's where your vaporizers will be mounted. We do also have a scavenger assist if the scavenger system that's installed isn't quite enough. And so when we turn these on, we can turn up the scavenger assist, and you can hear it's pushing air out right now into the back out of this scavenger port right here. And so that would be your scavenger assist. And of course, it could be much stronger as well. And there's just an on-off switch for that. So the next part on here, these are your valves. We call this the valve cover. These will be going up and down. You can't really see the disc really well because they're clear. The ones you would be getting on a system would be kind of an opaque color, and you could see them going up and down a little bit easier. We'll show the action of those once I turn it on. So on the back of the machine, we have 80 psi coming into the machine. We require a minimum of 60. The larger your animal is, the higher you're going to want to go. But right now we have it up at 80 psi. That's what's coming through this hose, into this block, and then into the different parts of the machine, including the control box. So basically, I've set this up. We have inspiratory time. That's how long it's going to be pushing the bellows down. This is the respiratory rate here. It can be changed anywhere from 2 to 80. When you're using the large animal side, you're probably going to be going anywhere from 5 to maybe 10 or 15, depending on how long you're pushing it down. This is how hard you're going to be pushing down on the bellows. We have low, medium, high. When you're getting into larger animals, you're going to be over on this side. Right now this is at 80 psi, so I think the furthest we can turn this up is when the needle stops. It looks like right about there. But right now I'm going to just turn it to the medium. I've got it at 1.6 seconds, and it's going to cycle 10 times a minute. And so right now I have it on standby, so you can see your digits. When you have it off, you can't see anything, of course. Even when it's off, let's say you lost power, we do have this manual button that will still allow us to ventilate. So let's just say if you were in the middle of a case and you lost power, you could have a technician that would sit here and push the manual button and keep the horse or camel ventilated during that time. So that's a nice safety feature of the system. Okay, so now I have it on standby. These are my settings. I'm going to go ahead and turn it on and let it exercise. Like I said, this is going to be pushing down the bellows and pushing the air into the animal, so you'll see these bellows go up. So as that one is going down, the patient's lungs will be filling up. Right now I have it cycling 10 times in a minute. And so for 1.6 seconds, we'll be pushing the bellows down. If I wanted to go a longer, harder, a bigger breath, I could just turn this up. And we'll come back and we'll look at it. We're going to, looks like about 16 liters on one push. Okay, on the absorber side here, just realizing some of these knobs aren't tight. I'm just going to tighten them down real quick. Okay, you can watch, this is a CmH2O, centimeters of water. And at rest is your PEEP, built-in PEEP in the system. And when it's cycling, it goes up to, looks like about 11. On the small animal side, this is the absorber. On the small animal side, this is the absorber here. Of course, the bellows are in here. Your tidal volumes determines how high you're going to start. And we're not doing anything with that right now. We don't have it hooked up. But then there's your, where's your soda lime material is stored in here. So it's a very similar setup, but it's for small animal side. This is anywhere from 20 to 300 pounds. And this is like over that, it's like 300 to 3,000 pounds. And that's basically the running of the machine. These are drain valves. If there's moisture that gets built up inside, then you can use these drain valves. Because this is tilted back a little bit, this is probably the one you're going to want to use the most to drain things out. The back of the machine here, you can see this is your control box. These are your mainstream hoses. They go down to here. And this is basically doing all the pushing powers coming through these two hoses, coming into the bottom box. I'm going to take the lid off so you can see inside the box. So the pushing power comes through here. These valves open up and it pushes down. Same with this one. So we got these two outer valves. We actually designed these valves ourselves because we could no longer buy them. That's one thing about our company is we've had to redesign about 5 different parts because you can't get them anymore. But we're always going to be able to service our Mallards because if we can't get the parts, we can make them ourselves. This center section is for the scavenger port. This is where you would hook up your vacuum hose to pull off the scavenger. That's the center port. That actually comes down right here into this section, that small hose there. And then when this bellows comes to the top, I'm going to show you. You'll see these two gas balance valves on the top. When those hit the top, they open up, and then the scavenger pulls out any excess isoflurane air from the animal circuit. This flow control meter goes from 0 to 10 liters per minute. Generally speaking, you're probably going to be running it somewhere between 3 and 4 when you're running the machine. This O2 flush button allows you to fill up the bellows, so I'm going to empty the bellows, just kind of give you an idea how that works. When you first set up the system, your bellows are going to be empty, and so you're going to need to fill those bellows up. And the way that you would do that is you would press this button here, so you initially would fill up the bellows right to the top. And once you have your animal hooked up and you have the bellows filled up, then you're ready to go ahead and start the cycling of the machine. This machine is also on rolling wheels. We do have locking wheels so that you can lock it in place, but it's very mobile, very easy to move around. And we also, this is the electronic version. We do have an MRI version as well, which can be used in an MRI setting. And that's about it.